We continue to follow some developing news today after a scary situation for 7 police officers in Hartford. The officers were lightheaded and nauseous after being exposed to drugs. Good evening, everybody. Thanks for joining us at 5:30. I'm Mark Sinney.
And I'm Kara Sundlin. This is not the first time that this has happened to first responders in Hartford. And we were curious about some of the lingering effects. Channel 3 Eyewitness News reporter Matthew Campbell has been digging deeper into this, and he's joined us live now from the North End on Garden Street with what he has learned. Matthew?
Well, Kara and Mark, we talked with a doctor who talks about what could be next for these officers. And then we also talked with the president of the Police Chiefs Association. And he says what happened here today is actually not uncommon. 2 officers taken to the hospital today in Hartford after they and 5 others were exposed to heroin, fentanyl, or a mixture of both, which, depending on amounts ingested, could be lethal.
Regular fentanyl is 50 times more powerful than heroin.
Hartford police say a suspect tried to throw the drugs out a window on Garden Street when the bag opened up.
But there have actually been police officers that have died from this, so you got to be careful.
Weathersfield Police Chief James Citran is the president of the Chiefs Association. He says an officer's risk to being exposed to these deadly drugs have risen. We actually saw a recent case a few weeks ago in Meriden. He says the price of these drugs have dropped, so the popularity has skyrocketed, and that's changed the way they investigate.
Opening up envelopes, you're not opening things like that. Yes, complete change from what we used to do. But it has to be. The danger is too great.
Dr. J. Craig Allen, the medical director at Rushford, explains some of the dangers that officers were exposed to today.
Their life could potentially be in danger, but if someone is there to keep the airway open, keep them breathing, then generally people make it through.
Officers are also equipped with Narcan, the overdose reversal drug. Sometimes it's used on officers exposed during a response. But Dr. Allen says the Narcan could wear off while the drugs are still in your system, so recovery could take days.
The opioids then settle again on the receptors, and you could lose consciousness again.
Now, doctors say a new approach when officers arrive to scenes like these could be to wear masks. Now, the officers involved today, they were all hosed down, and they will be monitored as the days go by. For now, that's the latest. Live here in Hartford, Matthew Campbell, Channel 3 Eyewitness News.